Thank you very much. That's always humbling and slightly weird to hear everything about you in one presentation. Thank you absolutely to all of the wonderful organizers for inviting me to come and present today. This is a topic that is very, very near and dear to my heart, my research, my practice, and so it's an absolute honor to be here today. I was asked, there we go. Whoa. Okay, simmer down. All right, so I was asked to talk about not only my research and programming in children and youth across neurological disorders, but I was asked specifically to address some of the global work that I do and why that's important and why we in the US should really be interested in partnerships at that global level. And I'm happy to do that, and I'm thrilled to do it. And I want to make sure that before I say anything else, we situate the conversation in the words of the children themselves, so that as I'm up here chitty-chatting along about all the work I do, we are reminded constantly that we're talking about children and youth, who are often some of the most hidden and vulnerable people in families in complex neurological disorders around the world. So this is a quote. Many years ago, I started my clinical practice in Washington University School of Medicine in the Department of Neurology. And one of our primary areas was Huntington's disease. And I did a study initially in Huntington's disease because I was going into people's homes and I was going into the nursing homes and I was going into the hospitals, and families were saying how tough it was for their children and youth. And then the children started saying, oh, and by the way, I'm doing things to provide care. I just learned how to disinfect my dad's feeding tube last week. And this was a 10-year-old. So it struck me that what we don't know enough about truly is the lives of these children and youth and their experiences. So this is a quote from my first research study on children and youth who provide care for a parent with Huntington's disease. And this, I will never, ever forget this young woman. She was 16 years old and was emotional throughout the entire interview. And one of the most profound things she said was, if someone says, how's your mom doing? I'll say, oh, she's doing all right. But maybe it'd be nice if someone asked me how I was doing. Like, because I will have an answer. And let me tell you, ladies and gentlemen, she had quite the answer. So as we move forward throughout all of my slides and our conversations and questions, let's keep this young woman in our minds so that she really guides our conversation. So why do we care about building children and youth global partnerships? Some of these pictures I am incredibly proud of. The one in the top is of some of my partners at the Baragwanath Hospital in Soweto in Johannesburg, South Africa, where I have the absolute honor to work with some of the most amazing rock stars on the planet who are doing so much with so little. In the top right-hand corner is an ALS group in Seattle. And then below is all of my research partners at the University of Utrecht in Netherlands. And so it is extraordinary to be able to connect with folks around the world and say, why should we care about children and youth in ALS and motor neuron disease? Why aren't we just focusing on the people who have it? Why aren't we just focusing on the adults? Well, the truth is we know that our children and youth are providing care, and they're also doing it with very little information. So while we think about what adults do to provide care, and we're always thinking, what do we need to tell these adults? How do they know? What's going on there? There's this army of children behind them that are existing with very little information and support. And if we do it at the global level, we can share. We don't have to keep recreating the wheel. We can bring something we created here in the US to South Africa and the Netherlands and Colombia and Turkey, as opposed to saying, we know what we're doing and we're going to keep it here and we're not going to partner. So what do we know about children and youth and illness? So this really relates to some of my earliest work in how families do, or quite frankly don't, talk about illness. And we know that families really struggle with that. I'm concerned about showing emotion. I don't want to cry. I don't want to overly emote in front of my children or my grandchildren. We know that they want to protect their children and youth from whatever might be happening with this illness. They don't want to expose them, missing the point that they are already, in fact, exposed. We also know that there's a lack of understanding around the specific disease because of that overwhelming emotion of receiving a diagnosis. Sometimes there isn't enough information because that emotion and that fear and that real desire to not want to talk about it as an individual, then that relays onto the fact that we aren't talking about it with our children and youth. The other point is the cultural piece, and I am extraordinarily lucky to work across quite a few different cultures and understand how people do and don't talk based on cultural expectations, assumptions, stigmas, barriers. We can add all kinds of words. Some groups, some cultures say we don't talk about it. Some say we talk about everything, right? But it's about understanding what are those family expectations, what are those cultural guides, and that should really guide everything we do in being respectful and culturally humble in the presence of families around the world living with ALS and motor neuron disease. So in final, when we think about how families do and don't talk, when parents and grandparents are not expressing, are not reaching out, and are not having that conversation, they're modeling that to our children and youth. And then our children and youth are thinking, okay, I'm not gonna ask the question that I've really wanted to ask, and maybe I'll go on the internet, which is always a bad move, right? So these are just some of the important research findings that help guide us to think about how we understand how families are talking and what we can do as professionals to help change that conversation. And one of the things I want to be really clear, and I'm very excited about, and I believe I saw a table next door with some resources. I have been incredibly fortunate to partner with the ALS Association over the years and have been able to write a number of books based on and using explicitly my research in this area to help families have this conversation. And one of the books is the Families and ALS Guide. And not only do we talk about kind of what are some of the barriers, the do's and don'ts, but we have sections in there that talk about how do you talk to children according to their developmental age and stage? How do we understand how to talk about end of life according to their age and stage? So it's critical that we grasp that little children aren't going to get it in the same way that our teenagers are. And that's what we've put in this book. I'm very proud it's been translated into Spanish and Dutch, in case there's any Dutch speakers here. And then also a book for school personnel. I have the great fortune of doing a lot of work. I'm from the University of Wisconsin in Milwaukee. Brewers broke our heart the other night. I have the great fortune of working with Milwaukee Public Schools, which is an incredibly diverse, very underfunded, very complex public school system. And I have worked with the school social work for many years and have the opportunity to talk to them about how do you talk to kids when there's illness in the home? Do you talk to kids when there's illness in the home? What do you even know about it? What kind of questions are you asking? So out of all of that work, I wrote the book for At School. And what this does is it gives our teachers, our social workers, our school counselors, our nurses, the support and the guidance to really have those conversations, because so many of these kids exist in the shadows. They exist in sleeping in class and being truant and only be seen as that bad kid that doesn't come to school. What they don't know is what's happening at home. So these are incredible resources. I absolutely encourage you to check out that table next door. Another thing I want to bring into the mix is some of our global conversations. So those books were written about my research here in the US. When I'm in South Africa, I spend lots of time with families and saying, what do you guys need? How can we best do what you need in the context of what's available, in the context of language, in the context of culture and accessible resources? And they have just been extraordinary. Talking about, ask them, how do we talk differently about it? Like, providers shouldn't just assume that we have the conversation in the same way that they might. There are 11 different official languages in South Africa, and each one of them represent different cultural traditions that need to be honored and respected. And they really bring up a lot of conversation around spirituality and religiosity and clergy and pastors. All of those things that sometimes in the US we either get weird and don't want to talk about, or we only assume there's like one option, right? So it's incredible to learn from people outside the US to say, how are they addressing it as well? And how can we integrate that here? And aside from just having the conversation about what we know parents and families do and don't talk about the illness itself, we're drilling down into saying, how do we know children and youth talk about, experience, or get support being an actual caregiver? And this drawing was done by a 13-year-old. Her name is Bella. She gave the picture to me. We were doing a project with some children and youth in Wisconsin and asking, kind of share your experiences. What is it like being a caregiver? And she drew herself with the raindrops. You can't see them very well, but in each raindrop is an emotion. And trying to shield herself with her umbrella from all of the overwhelming emotions and experiences in caregiving that she feels bombard her. And it was really profound because that helped me and my amazing colleagues at the ALS Association Wisconsin and the Medical College of Wisconsin to think about, what can we do for our children and youth who are caregivers? But before I say what we're going to do, I'm going to tell you what we know. And I've done a lot of research in this area across populations, and it might surprise some of you, maybe not. But if there is something that an adult is doing to provide care, there is a child somewhere doing the exact same thing. Children and youth as caregivers aren't just doing kind of simple things or a few things. No, they're doing all of it. They're bathing, feeding, toileting, transferring, using Hoyer lifts, communication equipment, range of motion exercises. They are dealing with pressure sores, wound care, you name it, they're doing it. But we just don't acknowledge it. We just don't say a whole lot about it as a society. Some of it has to do with shame or stigma. If I acknowledge my child as a caregiver, are you going to take them away? Let me tell you, as a social worker, I've gotten that many times over the years. I've had people tell me at conferences that I should be ashamed of myself for this type of research because it's abuse and neglect. And the truth is, in the absence of true abuse and neglect, these children are actually doing care. What they need is support. And this is based on some of my earliest work in Huntington's disease and reflected all the way through my work in ALS. When you ask a child or youth what they need, they will tell you what they need. And they need emotional support. They need friends who get it. They need families not to treat them like they're weird. But they also need hands-on instrumental support. They need someone to actually tell them how to do the thing that they are already doing. They need someone to tell them about the disease. What the heck is going on with Dad? What is this issue? And so taking this information, what we know about how families do and don't communicate, we know that there are no, at that point, there were no actual education and training support programs for children and youth. And one of the things that I am incredibly proud of being able to create to really support these children and youth, not only in the US, but around the world, was the development of our nonprofit with myself and some wonderful partners, including colleagues in both Canada and South Africa, is global neuro-Y care. And the goal is to take what we know in the US, what we know in Canada, what we know in Korea, what we know wherever we know it, and make sure that we have a clearinghouse, that we have a place where we can translate, we can have materials be accessible, and we can share them globally so that people aren't constantly having to recreate the wheel. And I'm gonna talk about a few of our programs, and there's a QR code, which is apparently the cool thing to do now, put a QR code on everything. But there's a QR code, you can do that and you can access our website. This is a slide I'm so freaking proud of because it's our global partners. These are the organizations in the US and around the world that I am beyond honored to partner with on different programs, on research projects, on clinical work. And it shows that there is so much value in hearing each other's voices and not staying locked in wherever we are in whatever geographic location we are in. But this is actually not even all, but it's all the ones. Sometimes it's hard to cut and paste someone's logo, but anyway, this is most of them. So the first program I'm going to talk about, and I know I only have a few minutes, I've gone on quite a bit, is the Y Care program. And this is a program specifically for children and youth who are providing care to a family member with a neurological disorder. And this was, again, started out of my work with the Medical College of Wisconsin and the ALS Association, trying to figure out, we have all this data, we know kids are doing things, we know nobody is telling them how to do it. How can we do it? And through the course of many fits and starts and kind of doing it the wrong way and figuring out what the right way is, we created the opportunity for kids to come to a 3-quarter day program and meet directly with healthcare professionals who've been trained in the program. So these are OT, PT, speech, respiratory, social work, neurology, who've been trained in the Y Care program, who deliver skill and support-based training over the course of multiple modules throughout the day. We have tested it in ALS, Alzheimer's and related dementia, in the military and veteran community who have experienced spinal cord injury, traumatic brain injury, and PTSD, as well as autism, so children who provide care to a sibling with autism. And this is the handbook that they get. Every kid gets a handbook that goes through what the disease is, kind of lots of pictures. Every module has its own pictures and sections. They can take notes. And the point is that when the kids go in the room, they can touch anything. They can mess with anything. They can press every button they want to press. They can pick anything up. And it gives them that safety and that freedom to mess around with things. Ask the professionals, how do I do this? The professionals give them that guidance. They try it out. They give them any sort of feedback. And then the kids need to teach it back to the other people in the room so that then they really absorb what that is. But they're doing all of this in the context of other kids. And that is the critical piece, is that it's a peer-engaged program. They're meeting kids that they've never met before. All of a sudden, they're in a group with 5 or 6 kids around their same age, and now they can talk about ALS totally, freely, comfortably, with no weirdness. And they are building those lifelong connections. We've adapted it to a global audience, and when we've done it in South Africa, we've done it in South Africa multiple times. We've translated the materials into 4 South African languages, and we've adapted in a way that reflects that there isn't the ease of access to durable medical equipment or all the multiple providers. So we work with families, we work with community health providers, we work with other folks to really adapt and provide the Y Care training. Global partnerships, I'm going to go quickly. We're now working on Y Care with ALS Canada. We're translating everything into French, the Quebecois French, which is apparently very different, I've been told. And these are some of the versions in South Africa. So it's in Zulu, Sesotho, Afrikaans, and Xhosa. I don't do the click very well. These are our professionals. So we've trained over 100 healthcare providers across the US and South Africa. And what we know, and we have a survey in the field now, we know that when they go back into their clinics, it changes the way they think about care. It changes the way they think about kids. It makes them go, oh, wait a minute. These are children and youth. Let me ask the families, because the families don't bring their children to clinic. And so they often don't know. So now they start asking, and now they're starting to integrate a more family-centered holistic program. Really quickly, I'm incredibly proud. These are several of the other books that I've written. The ALS graphic novel was written using the actual words of real kids in my research, talking about what they do and don't know about ALS, talking about caregiving, school, and we have a large section, as I do in all of my work, on death and dying, grief and loss. We cannot skip over those things with our children and youth. We want to because it scares us, but they know about it, and we can't shy away from it. So we have to do it in a way that is accessible. And I'm incredibly proud that through Global Neuro Y Care, we've been able to translate this book into multiple different languages, as you see, including we are in the process of having it done in Icelandic and Korean, but French, German, Italian, Dutch, Turkish, Spanish, Vietnamese, Zulu, Sesotho, Afrikaans, I missed Xhosa. And then these are all available on Global Neuro Y Care's website. I'm going to talk about this briefly because I want to get to Lukey and the Lights. This is a new program that we're building out in Global Neuro Y Care. I've had so many professionals come to me over the years and say, I'm a clinic nurse, or I'm a doctor, and families say, tell me how I should talk to my kids. And they don't know. They don't have that structure or that guidance. So we're working on a program now that gives healthcare providers the skills, the training, the support to have that conversation, at least to help families start that conversation. So that'll be a webinar, in-person workshops, and educational materials. Okay, the last thing I'm going to talk about, and I apologize I'm going over, but is the film Lukey and the Lights. So if you haven't heard of the film Lukey and the Lights, this is a still from the film. It's an animated short. It's about 10 minutes in length, and it was created by this guy, Anyo. And Anyo, I knew I was gonna cry. Anyo is my brother from another mother, and he's Dutch and was super difficult and the most wonderful, amazing, brilliant, irritating person you've ever met. And he passed away in March. And he and his wife created the story of Lukey, which is a robot full of light bulbs. And as ALS progresses, the light bulbs go out. And this is one of the many times I went to the Netherlands and hung out with them and talked about how we're doing this film, how we're writing this film, what's going on here. And we would walk in the woods and have these conversations and sometimes fight. But that's what siblings do. And Anyo was diagnosed at the age of 35. They had 2 young children, and they wanted to find a way to talk about ALS in a very simple, accessible way. And the end is a film that is something myself and our colleagues and the amazing support of the ALS Association allowed us to finish and create this film. Our partners at Big Grin Productions, which is a Los Angeles animation studio, literally people around the world made this film. And that's Sasha and Anyo right in the middle. And there's no language. So a kid in South Africa can watch it, and a kid in the Netherlands can watch it, and they can understand the exact same thing because there's no language. And it helps us really have these continued global accessible conversations. And one of the things that we have as part of Lukey and the Lights is educational materials. So we have a coloring book, and the coloring book is not just a coloring book, it's an activity book. We have pauses in the coloring book where we say, what did you think when you watched this part of the film? Did you feel, what about caregiving? Do you do things to help take care of somebody? We have an educational packet in the upper right-hand corner. That's for providers, for clinicians, for families, for schools. There are several sections on Ask Lukey, which are kind of questions that are posed to Lukey, and Lukey answers them in both young children's age and then older children. We're always trying to think about that developmental age and stage of learning and accessibility. And that's one of the pictures that a group of kids colored from the film. And then you can watch the film at our website, globalneuroycare.org/fullmovie/. It's there, but you can also go to the QR code. And you can watch the film at any time. It's available. All of these materials are free, available, download. Please go and print and download everything. My closing takeaways. I've talked fast and a lot. I probably could talk, well, not probably, I know I could talk about this for like 8 hours, so buckle up, everybody. I'm kidding, I'm almost done. The global need for recognizing children and youth cannot be said enough, cannot be underscored enough. And what we do here in the US is absolutely spectacular, and it has translation, and it has the opportunity to inform and really change the lives of children and youth around the world. And I am incredibly grateful to be a part of that process, to be a part of children's lives around the world. And I want to say a big thank you. I didn't talk about, I still do a lot of research. I do research on how caregiving influences sleep and well-being in children and youth who are caregivers. And I have some of the most amazing colleagues, not just in Wisconsin, but my research collaborators in California, in Utrecht, and in South Africa. And this is Nifa. This is Anyo and Sasha's youngest daughter, who's my buddy. And I just wanted to say thank you to all the families who constantly give so much support and their own just guidance to me and my colleagues who are gifted to be able to do this work. So thank you very much. Oh, questions? I stunned you into silence, that's fine. Happy to answer any questions or comments. That is my email. Please feel free to email me. Yes, ma'am.
Just a quick question. Wondering if there is a country that you feel that does it really well, in including children and families.
Yes. So a country that does it really well, the UK. And not just in motor neuron disease, just writ large when it comes to children who are caregivers, when it comes to understanding the research, the programming. They have actual social programs. They have a bursary program. They have a Bill of Rights for children who are caregivers. Now, the UK is super teeny tiny compared to the US, so understandable that they have that opportunity. But yes, when it comes to young carers writ large, I will say when it comes to families and youth and ALS, not to toot our own horn, we do lead the charge here in the United States, but lots of countries have, and we've partnered with so many countries, so it's, we share all of our materials with anybody and everybody. So we want everyone to have equal access, but yeah, it's a good question. Do I stand between you and lunch? Close. Well, I think that's it. Yeah, no questions. Thank you all again.